Okay, so we have sensory perception, which are the five senses. And I'm Monica, Marilee, and Ivana. So the definition of sensory perception is simply defined as according to the North American Nursing Diagnosis Association. Impaired and disturbed sensory perception is a change in the amount of patterning of incoming stimuli accompanied by the diminished, exaggerated, distorted, or impaired response to such stimuli as those associated with the client's visual, auditory, tactical, gustatory, olfactory, and kinesthetics response to these stimuli. Okay, and so we have vision, hearing, smell, taste, and touch. So your vision, basically, you can judge your depth of field with this, and you interpret and see the world around you, basically, which is colors and just anything that stimulates your eyes. So like the light entering your eye and changes the perception of everything. So hearing is the sound, and it helps you maintain balance, and it distributes the pressure between your ears and your sinuses. So you can easily get off balance if that's not maintained correctly. And so smell, your nose, identifies chemicals and has a connection with memory. So sometimes you can be anywhere and you can smell something and it reminds you of, say, like your grandparents or whatever else. So there's taste. So you taste food and it helps you identify like hot and cold and sour and sweet. And so then you have touch, which regulates temperature, and it senses hot and cold as well. And the feeling just of touchless sensation, which is you can be like tickled or stimulated in any way with the touch. And so vision, it's an impairment that has a big impact on the quality of life, according to ARVO journals. Bad vision leads to fractures, depression, social isolation, and a greater risk for admission to a nursing home. And so we have management of care of vision. So you want to see a optometrist regularly. If you don't have any problems with your eyes, you can go once a year. But if you do have problems with your eyes, it's better to go more often. And you want to protect your eyes from the sun, from chemicals, from anything that could possibly like splash in them to injure them. You want to avoid straining, and you want to keep a good diet and refrain from smoking, because smoking does damage your eyes. And then we also have the safety and management and basic care and comfort for vision. So you would want to assess for fall protocols or fall precautions. So you want to keep the area around the patient clear of anything if they have any visual disturbances or anything like that. You want to speak to the patient at eye level if they have any kind of vision impairment, because they're able to see you better, especially if they have any kind of visual disturbances on your peripheral vision. So if they are having visual problems, you want to make sure they have corrective lenses or glasses. You want to assist the patient with eating. So like if they have a really hard time eating or seeing so they can eat, you can orient them to their plate like as a clock. So you can tell them that their potatoes are at 12 o'clock and stuff like that to help them see better, or help them quote unquote see better. You want to ensure the room is, like I said, free of clutter and the lighting is good, and to help them reduce like the fall risk and stuff like that. And so a physiological adaptation for the patient would be the patient is taught about newly prescribed vision corrective devices, such as like glasses or contact lenses, or if they need just reading glasses, when to use them or anything like that. And then you can help adjust the patient to the reading problems with like larger font if you have to give them any kind of reading material. And then the patient is taught to use a cane for if they're completely blind, and they're able to get around with one of those. And then a patient can be taught to use assistant animals. So that has proven to be really helpful for them. It's not only just for them to get around, but it helps them cope with things as well. Okay, and so we have the pharmacotherapy. So there's some medications such as latanoprost, Timolol, and prescription lenses to help correct vision problems such as glaucoma or any kind of interocular eye pressure. And then obviously your corrective lenses, which could be contacts or glasses to help them either read or just see far away in general. And then we have psychosocial integrity. So this would provide an environment free of physical and communication barriers, such as, like I said, with the reading stuff, you would want to give them documents that were larger font or anything like that, and then provide a safe environment free of clutter and anything like that to help them maintain their integrity if not being able to see. So you want to advocate for your client, and then you want to recognize the patient's strengths and challenges. So you want to kind of get to know your patient and see what is going to be harder for them in their daily life to maintain their ADLs. And then you want to provide grief counseling and coping mechanisms if they have complete vision loss, especially if they lost it over time instead of just being born with it or anything like that. And then we have smell.
All right, so smell arouses a person's appetite. If a person is unable to smell, it can lead to a bad diet, which leads to undernutrition or malnutrition. Smell also places a person at a higher risk for accidents because of the lack of sensation, and so they end up inhaling poisonous chemicals. For the management of care for smell, you want to make sure the patient is protected from harsh chemicals and to maintain good hygiene. So make sure they're not stuffy or anything. And for safety and management and basic care comfort, you want to once again protect from those harsh chemicals, make sure they know where they're at and the types of chemicals that they're using, and to avoid smoking just because it does affect respiration. And so anything as simple as allergies or any nose stuffiness can lead to that loss of smell. Okay, and now we have physiological adaptation. So you want to make sure that the patient adjusts to treatment that helps with the underlying cause that is leading to the sensory deprivation, such as the nasal congestion, discontinuation of smell altering drugs, and the removal of harmful chemicals, as well as cessation of smoking. And we have pharmacotherapy for smell, and that is amitriptyline and metronidazole as examples. And we also have the physiological integrity, which kind of goes hand in hand with the visual ones. You want to make sure that you advocate for the patient's self-determination, integration, choice, and the least restrictive alternatives. You want to recognize the patient's strengths and challenges, as well as provide any grief counseling or any coping skills. Okay, and then we also have hearing. Hearing allows for engagement in conversation, laughing, and listening. Any hearing impairment can lead to depression and social withdrawal. Okay. And for the management of care of hearing, you want to make sure that the patient is protected from any loud noises. You want to make sure you minimize any overstimulation and seek any care before it gets worse. And for safety management and basic hearing comfort, you want to make sure that the patient has their hearing devices, that they have the batteries in it, that they know how to use them and place them properly. You want to make sure you speak slowly and clearly to the patient. You want to make sure you're within appropriate distance and they can see you and they can tell what you're saying. You want to make sure you provide written documents. That way, in case the information isn't being transferred correctly through talking, they have something to look at. And you want to make sure to decrease loud noises within the environment. You want to reduce that stimuli to allow for better concentration on what's being said. Okay, and for physiological adaptation, the patient is taught about newly prescribed hearing aids, so they have to adapt to that device in their ear. You want to teach them or send them to people who can teach them sign language or lip reading, so they have to get used to that. The patient can also use written communication, and the patient is also taught the use of assistive animals.
Okay, then we have hearing. So some of the pharmacotherapy would be antibiotics, corticosteroids, hearing aids, and cochlear implants. For the psychosocial integrity, we're going to provide an environment free of physical and communication barriers. You'll advocate for your patient. You'll recognize what their weaknesses are, what their strengths are. And then if a patient is newly to like being completely deaf, you would provide some type of counseling and coping skills for a patient that may have the long-term sensory perception. For antibiotics, you want to educate the patient to complete the whole antibiotic so they don't become resistant to it. And then for corticosteroids, you'd educate that could actually reduce the swelling. So whatever is causing, if the swelling is what's causing the hearing loss. And then for the hearing aids, they can be used in older adults and in children, and that can be greatly improved for one's daily life. And then for cochlear implants are used for one or both ears or the internal structure of the ear that are not properly functioning. And then we have taste. It's essential for survival because it allows a person to choose the correct food, which is necessary for existence, function, and maintenance. Taste impairment places a patient at risk for ingestion of expired food or undercooked food. So for management of care, we're going to provide proper dental care. So that could be like make sure that they're taking care of their teeth and their mouth, because if they have infections and their teeth are rotting or they have like pus in their mouth, that would definitely make them not want to eat anything. Keep a low sodium diet, and then eat a variety of a diet. And then for safety and management and basic care and comfort, we're going to provide a proper diet and then educate on routine dental visits so the mouth care doesn't deteriorate. And then the psychosocial adaptation, patient will adjust to the treatment of the underlying condition that is causing the sensory deprivation, such as nasal congestion. Anytime you get a cold or any type of nasal, like the loss of the taste is pretty usual. So if you discontinue any drugs that are altering your taste, and then cessation of smoking. And then the pharmacotherapy, it says there's no specific medication to treat a loss of taste, and taste should usually return once the underlying problem is found and treated. So for the psychosocial integrity, we'd provide an environment free of physical and communication barriers. We'd advocate for the patient. We'd recognize their strengths and challenges. If this does happen to be a permanent thing, we would provide counseling and provide coping skills for a patient. And then we also have touch, which is a vital human need. It allows us to receive information such as hot and cold sensation. An impairment in touch will place a patient at risk for burns, hypothermia, or hyperthermia.
Sorry, I'm still not sure.
For touch management of care, we're gonna maintain proper nutrition. You're gonna take care of your skin and you'll stay active. And then for safety management, care and comfort, you would maintain patient skin integrity. We're gonna perform frequent skin assessment. If they're admitted for a long-term stay, you would rotate the patient every 2 hours. If at home and you're having sensory problems, you would use the little knob in your water boiler to set your temperature so the water doesn't get too hot or too cold. And then you'll educate the patient in dressing appropriately for the weather. And then physiological adaptation. The patient can be described assistive devices such as walkers, canes, and wheelchairs. The patient can use tools that assist with ADLs, such as adaptive pencil grips, switches, and utensils. And then for medications, we'll use duloxetine, antidepressants, anti-seizures such as gabapentin, and then pain medications. And for the psychosocial integrity, it's going to be the same thing. We're just going to provide an environment free of physical and communication barriers. We'd advocate. We would recognize their strengths and the challenges that they face. So we're able to educate on the challenges that they're facing and hopefully help them correct it. And then if it's a permanent sensation loss, we would provide counseling and provide coping skills for the patient who has long-term sensory loss.
And these are our references. And that's it.